If you have diabetes and want to lower your A1C levels, I'm going to show you 8 easy ways to follow and control your diabetes. What is hemoglobin A1C? Your blood is full of red blood cells. Red blood cells contain a protein called hemoglobin which carries oxygen throughout your body. When the two come together, they create what is called hemoglobin A1C. To measure your A1C levels, you need a blood sample either in a tube for an A1C test or as a drop for a finger prick test. A finger prick test only tells you how much sugar is in your blood at that very moment. Both tests are very important for overall blood sugar management and control. Your A1C, unlike your finger prick test, measures your average blood sugar over a period of 2 to 3 months. If your A1C is 6.5% or more on an initial test and on a repeat test, the American Diabetes Association (ADA) considers this to be a positive diabetes diagnosis. Diabetes can increase your risk of heart disease, kidney disease, eye disease, and nerve pain. How do I lower my hemoglobin A1C levels? It is important to understand that lowering your A1C levels is a gradual process. 1. Eat fewer carbohydrates. Of the 3 macronutrients, carbs, protein, and fat, carbs have the greatest effect on blood sugar. When people with diabetes eat foods high in digestible carbs, their blood sugar levels can surge. High carb intake typically requires high doses of insulin or diabetes medication to control blood sugar. Eating fewer carbohydrates can significantly reduce blood sugar levels, promote weight loss, and improve heart health in people with diabetes. In addition, these improvements often occur very quickly. For instance, in a study in people with obesity and diabetes, limiting carbs to 21 grams per day for 2 weeks led to a spontaneous decrease in calorie intake, lower blood sugar levels, and a 75% increase in insulin sensitivity. Eat more fiber. In people with diabetes, fiber, particularly soluble fiber, can slow the absorption of sugar and help improve blood sugar levels. A healthy diet that includes insoluble fiber may also reduce the risk of developing type 2 diabetes. According to American Diabetes Association, it's recommended women eat about 25 grams and men eat about 38 grams of fiber per day. To put that into perspective, one slice of whole grain bread is about 2 to 3 grams of fiber. Fiber has many health benefits which could help people with diabetes. 3. Stop drinking calories. Sodas and other sugar-sweetened beverages can increase the risk of type 2 diabetes, weight gain, and metabolic syndrome. Excess weight is a risk factor for developing type 2 diabetes, and both obesity and diabetes are features of metabolic syndrome. For people who already have diabetes, this type of drink provides large amounts of sugar and requires little digestion. In addition, these drinks are not filling as they contain only simple carbs and no fiber. This means that a person can easily drink a lot of them. 4. Eat more protein. There is increasing evidence that a modest increase in dietary protein intake above the current recommendation is a valid option toward better diabetes control, weight reduction, and improvement in blood pressure, lipid profile, and markers of inflammation. Increasing the absolute protein intake from 1.5 to 2 grams per kilogram during weight reduction has been suggested for overweight and obese patients with type 2 diabetes and normal kidney function. This increased protein intake does not increase plasma glucose, but increases the insulin response and results in a significant reduction in hemoglobin A1C. 5. Exercise. For people who have diabetes or almost any other disease for that matter, the benefits of exercise cannot be overstated. Exercise helps control weight, lower blood pressure, lower harmful cholesterol and triglycerides, raise healthy cholesterol, strengthen muscles and bones, reduce anxiety, and improve your general well-being. Exercise lowers blood glucose levels and boosts your body's sensitivity to insulin, countering insulin resistance. Exercise lowered HbA1c values by 0.7 percentage points in people of different ethnic groups with diabetes who were taking different medications and following a variety of diets. All forms of exercise, including aerobic, resistance, or doing both, were equally good at lowering hemoglobin A1C values in people with diabetes. 6. Medication if needed. If you have prediabetes or diabetes, your healthcare provider may prescribe medications to help lower your A1C. But remember, these medications do not work unless you take them consistently. Whether or not you feel fine, you are at risk for serious complications if your A1C levels are high. Take your medications the way they were prescribed to you. 7. Manage stress and mental health. According to ADA, stress can directly impact your blood sugar levels. When your body is under stress, it gets ready to either fight or run from the source of stress. Your body needs energy in the form of sugar to do this. So, a hormone called cortisol is released to increase the levels of sugar in your body. Since day-to-day life can be stressful, finding ways to manage and lower that stress is key to maintaining healthy blood sugar levels. 8. Take natural supplements. Apart from the above suggestions, there are some natural supplements you can try that may help reduce blood glucose levels and for general overall health. Several supplements have shown promise as diabetes treatments. These include the following. To name a few: cinnamon, chromium, vitamin B1, bitter melon, green tea, and magnesium. Please note that supplements should not be used to replace standard diabetes treatment. Doing so can put your health at risk. Thank you very much for listening. If you like our video, please share it with your friends and family and hit the like button. And remember to subscribe for more healthy videos. Most importantly, have a great day. Thank you.